Welcome to The Explainer. Today, we're breaking down a really important tool used to understand the risk of violence. It's called the HCR 20. And as you'll see, the whole point isn't about getting some final score. It's about understanding that a person's risk is a story that's constantly unfolding.
Okay, so let's jump right in with a question that gets to the absolute heart of this. Picture this. You've got a risk assessment for someone, but it was done 5 years ago. Can you actually rely on that today to make a big decision? Is it still valid?
Well, the answer, from pretty much everyone in the field, is a hard no. An assessment that old isn't just a little outdated. It can be seriously misleading, and we're about to get into exactly why.
The big issue here is what we can call the snapshot problem. Any single assessment is basically just a photo, freezing a person in one specific moment in time. But here's the thing. People aren't static photos, are they? They're constantly changing. Our source material really puts it bluntly. Relying on an old HCR 20, well, it's kind of like using a 5-year-old weather forecast to decide if you should bring an umbrella today. The information is just too stale to be of any real use.
So why does that accuracy fade so fast? Well, it's because all the things that actually influence risk are always in motion. A person's symptoms can change, how they respond to treatment can evolve, their housing situation might be totally different, their support network could disappear. All of these things make that old snapshot completely obsolete.
So how does the HCR 20 get around this whole snapshot problem?
Well, it does it with a really clever distinction between two totally different kinds of risk factors.
It separates what we call the trait from the state. The easiest way to think about it is this. Trait is like the overall climate of a region. It's the stable, historical stuff that sets a person's baseline. State, on the other hand, is today's weather. It's the dynamic, current factors that tell us what's happening right now.
And here's where it gets really fascinating. The HCR 20 is literally built to see this difference. The historical scale, that's the H, looks at past behavior, and that's the trait. It barely ever changes. But the clinical and risk management scales, the C and R, they captured the state. And just look at how fast those can change. We're talking weeks, months, or in the case of risk management, sometimes immediately.
This whole approach has a name, structured professional judgment. And the key idea here is that the goal isn't to just slap a number or a label on someone. No, it's about creating a living, breathing plan to manage risk based on what's actually happening in their life right now.
Okay, so that brings us to the element of time. Because even the most accurate, up-to-the-minute assessment of someone's state has a shelf life. There's a ticking clock.
I mean, it makes sense, right? A person's life is always moving. New stressors pop up, support systems change, health fluctuates. So naturally, the predictive power of that weather report is going to fade over time.
So what's the window? How long do we have before that assessment starts to get stale? Well, the research points to a pretty specific time frame. For about 6 months, the accuracy is strong. After that, it really starts to drop off.
And listen, this isn't just some random number they pulled out of a hat. Our sources point to a 2024 study that confirmed this 6-month window. And it's become so accepted that huge health systems, like NHS England, have actually made 6-month updates a standard part of their practice. It's that important.
So the really crucial thing here is knowing when to hit that refresh button. It's not just about watching the calendar, it's about spotting the specific triggers that tell you it's time to get a new reading on someone's current state.
And here they are, the key triggers. Of course, if an assessment is over 6 months old, that's one. But also, if there's a big behavioral shift, a new incident, or a major change in medication, or if a critical decision like discharge is coming up, it's time for an update. You have to make sure those big decisions are based on what's true today. And that transition from a superstructured hospital setting to the community, that might just be the most critical trigger of all. Why? Because everything changes. The support system, the daily stressors, access to old triggers, the state factors just shift dramatically.
Let's bring it all home with this quote from our sources, because it just says it all perfectly. The history, that gives us the baseline, the trait. But the clinical and risk management details, that gives us the current state for a specific time and a specific place. Our risk assessment isn't a life sentence. It really is a dynamic, changing story.
And so this leaves us with a really big question to think about. The HCR 20 shows us that risk is dynamic, it's fluid. So the challenge for our systems, for healthcare, for justice, is to be just as dynamic, to build systems that focus on who a person is today and what the plan is for tomorrow, not just on a snapshot from their past.